Ever heard the saying, out of sight, out of mind?
Sure.
Well, it seems like Anthem Blue Cross Blue Shield is taking that to a whole new level.
How so?
Right after the United Healthcare CEO, Brian Thompson, was murdered, Anthem, they scrubbed their entire leadership team from their website.
Yeah, poof, gone, like they're trying to disappear.
Exactly. It's a little creepy, don't you think?
Definitely a bit unsettling, especially given the timing.
Makes you wonder if they're worried they might be next on the hit list.
I mean, who can blame them?
Yeah, scary stuff. But that's not the only reason Anthem's in the hot seat right now.
Oh yeah, the whole anesthesia policy thing?
That's the one. They basically wanted to put time limits on how much anesthesia they'd cover for surgeries.
Starting February 2025, the plan was using, get this, physician work time values.
Physician what now?
Work time values. It's a metric from the Centers for Medicare and Medicaid Services.
So basically, Anthem was saying, we'll only pay for this much anesthesia time based on what we think your surgery should take.
Exactly. And anything over that, well, tough luck. You're on your own for the extra costs.
Which is insane, right? Because every surgery is different. Every patient is different.
Absolutely. That's why the American Society of Anesthesiologists, the ASA, came out swinging against this policy.
They were not happy.
Not at all. They said reducing anesthesia to a rigid time limit was dangerous, could really compromise patient safety.
I mean, picture this. You're in the middle of surgery, and suddenly the anesthesia wears off because your allotted time ran out.
Nightmare scenario, right?
Yeah.
And it puts the surgeon in an impossible position.
Do they stop the surgery early, even if it's not safe, to avoid sticking the patient with a huge bill?
Or do they keep going knowing the patient might be on the hook for thousands of dollars?
Talk about a rock and a hard place.
The ASA was also worried that this policy would just incentivize surgeons to rush through procedures.
Which is never a good thing when you're talking about surgery.
Not to mention the financial strain this would put on patients. Surprise medical bills are already a huge problem.
And this would just made it a whole lot worse.
And here's the kicker. Anthem's parent company, Elevance Health, they had just announced record profits.
So they're raking in cash and then trying to pull this stunt.
Optics were terrible.
To say the least. And people were not shy about expressing their outrage.
Doctors, lawmakers, patient advocacy groups, everyone was up in arms.
And that's where things took a really interesting turn. Because Anthem, they actually backpedaled.
In several states they did. Connecticut, New York, they completely reversed course on the policy.
Yeah, they tried to claim it was all a big misunderstanding.
Widespread misinformation, they called it, insisting they would never, ever deny medically necessary anesthesia.
But come on, their initial announcement clearly stated they would deny claims exceeding those time limits.
Right, it was all right there in black and white.
So what do you think? Damage control or a genuine change of heart?
I think they realized they had stepped in it big time, and they were scrambling to save face.
Yeah, because the backlash was swift and fierce.
They definitely underestimated how much people care about this issue.
And how much power we have when we speak up.
Absolutely. This whole thing shows that when we raise our voices, these big insurance companies, they have to listen.
They can't just steamroll over us.
And they certainly can't hide, even if they try to scrub themselves from the internet. Makes you think, what are they really up to behind those closed doors?
Right. Like, what else are they trying to slip past us?
It's not just about the anesthesia policy, is it?
No, it feels much bigger than that. Like, it's about the whole healthcare system and who's really in control.
Especially with, the whole United Healthcare CEO situation.
It's like a dark cloud hanging over everything.
Makes you wonder, right? If someone is willing to kill for healthcare profits,
Yeah.
what else are they capable of?
Exactly. And then you have Anthem trying to pull this anesthesia stunt
Right.
while their parent company is reporting record profits.
The timing couldn't be worse.
It's just like a blatant disregard for patients.
Absolutely. And it really highlights the power imbalance in healthcare.
Between the big insurance companies and the rest of us.
Yeah, they hold all the cards, they control the purse strings.
And we're left trying to navigate this incredibly complex, confusing system.
Medical billing is a nightmare.
Seriously, it's like they're speaking a different language.
It's designed to be opaque, to keep us in the dark.
So they can sneak in these policies that benefit them, even if it hurts patients.
And that's why the political backlash to this policy was so important.
It wasn't just patients and doctors who were upset. Lawmakers got involved too.
Big time. Senators, governors, they were all over this.
Like Senator Chris Murphy from Connecticut. He called the policy appalling.
He went right after Anthem on social media, said they were putting profits over patients.
Which, let's face it, they were. And then you had Senator Jeff Gordon, also from Connecticut.
Right, he's a doctor himself.
He wrote this scathing letter to Anthem, demanding they explain themselves.
Basically saying, show me the evidence that this policy is necessary.
Because it really seemed like a purely financial decision.
Disguised as a cost-saving measure.
And then the Connecticut controller, Sean Scanlon, he got involved too.
He publicly announced that his office had actually blocked the policy from taking effect in Connecticut.
Talk about putting your foot down. He said people were deeply concerned about this.
And he worked directly with Anthem to make sure Connecticut residents wouldn't be affected.
So it wasn't just talk. They actually took action. And
Yeah.
Connecticut wasn't the only state that fought back.
Oh, no. New York went to bat, too.
Governor Kathy Hochul, she called the policy misguided.
And her administration really put the pressure on Anthem to back down.
She basically said, not in my state.
Uh,
And then you had Senator Mike Gianaris from New York.
he was fired up.
He said he was going to introduce legislation to ban this type of policy completely.
So that patients in New York would never have to worry about surprise anesthesia bills.
It was a full-on revolt from all sides.
And it wasn't like this policy was buried in the fine print. Anthem was very upfront about it.
They announced it on their website, sent notices to providers, the whole 9 yards.
So why do you think they caved so quickly?
It's like they thought they could just bulldoze this through, that nobody would care,
Maybe they underestimated how much attention this would get.
especially after the United Healthcare CEO's murder.
Right, that put everyone on edge.
Made everyone extra suspicious of anything these insurance companies are doing.
We were under a microscope.
And Anthem walked right into the spotlight with this anesthesia policy. They really miscalculated, didn't they?
They sure did. But, you know, in a way, it's kind of a good thing that they backed down so fast.
Wow, so.
Well, it shows that they're not invincible, that public pressure can actually work.
So we do have some power.
Absolutely. We have a voice, and when we use it, these companies have to listen.
So what's the takeaway here? What can we learn from this whole Anthem mess?
I think the biggest lesson is that we need to be more vigilant, more informed.
About what's going on with our healthcare.
Exactly. We can't just blindly trust these insurance companies to do the right thing.
Because let's face it, their priority is profit.
That's the bottom line.
So what can we do to protect ourselves?
Well, for starters, we need to demand more transparency. We need to know what's in our policies, what's covered, what's not.
And we need to hold these companies accountable when they try to pull a fast one.
Like they did with this anesthesia policy. We need to speak up, make some noise, let them know we're not going to stand for it.
And maybe, just maybe, we need to start thinking about different ways to do healthcare altogether.
Systems where patients come first, where
Yeah.
profit isn't the driving force.
That's a whole other conversation.
Mm-hmm.
But it's one we need to have sooner rather than later.
Absolutely. Because this whole Anthem situation is a wake-up call.
It shows just how broken the system is and how much work we have to do to fix it.
We can't afford to be complacent. We need to stay informed, stay engaged, and keep fighting for a healthcare system that puts people first.
Well said. This has been a fascinating and, frankly, a little frightening deep dive. But it's also been empowering
How so?
because it's shown that we're not powerless.
Mm.
When we come together, when we raise our voices, we can make a difference.
We can hold these companies accountable.
And we can demand better from our healthcare system. So let's keep this conversation going.
Yeah.
What are your thoughts on this whole Anthem anesthesia debacle?
Yeah.
Have you ever had a run-in with confusing or unfair medical billing practices? Share your stories in the comments, because the more we talk about these issues, the more likely we are to find solutions. And that's what this is all about, right?
Mm.
Finding a way to make healthcare work for everyone, not just the corporations.
Absolutely. It's time to put patients back in the driver's seat.
And to remind those folks hiding in the shadows at the Anthem that we're watching.
We're not going away.
And we won't be silenced. Thanks for joining us for this deep dive.